There are very strict enrollment periods when it comes to Medicare. The most common is your initial enrollment period, and it's a 7-month window. So it starts 3 months leading up to your 65th birthday month, the month you turn 65, and then 3 months after. When you're enrolling in your Medicare coverage in the 3 months leading up to your 65th birthday month, the effective date it will be the first of your birthday month. However, the exception to that rule is if your birthday lands on the first of the month. So say, for example, your birthday is February 1st. Well, your Medicare will start January 1st. If you're enrolling in your Medicare coverage in either your birthday month or the 3 months after, the effective date of your Medicare coverage can be delayed. And the Social Security office uses a fun little chart to help determine what effective date your Medicare coverage will be. So if you are applying for your Medicare coverage in your initial enrollment period, it's best to reach out to a licensed insurance professional to give you guidance on what effective date you could attain based on when you are enrolling. The other enrollment periods are the special enrollment period, or an SEP, and that's typically triggered when a person loses their coverage through an employer. So sometimes if a person is retiring, or if maybe they're reducing their hours to part-time and they're no longer eligible for their Medicare coverage, then they can enroll in their Medicare due to that loss of coverage. Another enrollment period is the general enrollment period, or the GEP, and that is January 1st through March 31st for a July 1st effective date. The general enrollment period is really for people who didn't enroll in their Medicare coverage when they first became eligible and don't have a special enrollment period. Well, now they've got this general enrollment period where they can enroll January 1st through March 31st for a July 1st effective date. Not only is your eligibility date delayed until July 1st, but you will also be assessed a penalty for Medicare Part B, and that penalty is 10% for every 12-month period you should have had the Medicare Part B coverage. The other enrollment period for Medicare is the annual enrollment period. The annual enrollment period, or the AEP, is October 15th through December 7th for a January 1st effective date. The annual enrollment period is really designed for current Medicare beneficiaries to evaluate either their Medicare Part D plans or their Medicare Advantage plans during that time frame. Because what can happen is the plans can change for the next calendar year in terms of the plan design, the premium, and the formulary, meaning the list of covered medications. And your needs could also change. So it's best to reevaluate your prescription drug coverage or Medicare Advantage plan during that time frame for the next calendar year. The Medicare website has a great tool. It's called the Plan Finder tool, and it's right on medicare.gov, where you can plug in your specific prescription information, and it's boiled down to the name of your medication, the dosage, how often you take that prescription, and your preferred pharmacy. And essentially what this tool does is it matches you up with the best or most appropriate plan. Not only does it do that, but it's going to outline for you month by month your out-of-pocket exposure for your prescription needs. You can also evaluate a Medicare Advantage plan, or Part C, during the annual enrollment period, because again, the plans can change and your needs could change as well.